Okay, we're live. Go ahead.
All right, here we are. All right, good afternoon, everyone. Everyone joining us live. I want to welcome you to the first installment of series of conversations called Talking Tina, conversation on Black gay men and meth, Black gay men and Latino men and meth use in our communities. This presentation today is brought to you by three different organizations. First off is the Harm Reduction Coalition, a policy and advocacy organization based hold on one second, whose intention is to support the dignity and support those who use drugs. Also, the Counter Narrative Project as well, which is an organization that advocates for the wellness of Black gay men as well as other social justice issues. And then Beam, Black Emotional and Mental Health Collective, which is an organization dedicated towards the wellness and mental health of Black communities. I'm joined today with three distinguished panel members to have this conversation. First off is Charles Stevens, who is the Executive Director of the Counter Narrative Project. Thank you for joining us, Charles.
Thank you.
Then we have Kenyon Farrow, who is the Director of Policy and Advocacy for TAG, Treatment Action Group. And then we have Dr. Ricky Bluthenthal, who's a professor at USC, who's long-term been done much work around injection drug use, as well as other health disparities in communities. Thank you so much, you all, for joining us today.
Happy to be here.
Thank you.
Awesome. So our intention for the conversation today is to really do two things, right? We want to have a one-on-one discourse on when we talk about, first of all, what is meth? Because we know a lot of folks who are doing work in Black gay communities may not be familiar with meth, may not be as intimately aware of dealing with this particular intersection of drug use. And so we want to have that conversation. And we also want to get into the complexities and nuances of what tools and resources do folks need to be getting linked up to, what particular nuances do folks need to consider, all those different things. And so I'm going to open it up by just kind of once again, with the 101, let's just start off. What is crystal meth? And anyone could take this question, whoever wants to take that.
Well, why don't I go? So, it's a series of chemicals. The crystal part is just a preparation that makes it possible to be snorted or injected if you break it down, or smoked, which is probably the most prevalent way that it's used. And then depending on how you consume it, the effects could last for hours or for less amount of time, depending on the method of administration.
Can you talk, Dr. Bluthenthal, can you tell us a little bit of how does it affect a person? How does crystal meth or meth affect a person?
Well, it's funny. I wish I was more clinical, but the basic my basic understanding of it, is it makes people amped up. It gives them energy. In the populations that I work with, mostly people report using it for a variety of reasons. So sometimes people use it to party, right, or to have sex. People also use it to just stay awake. So there are a lot of homeless folks in my studies with people who inject drugs. And so folks will talk about using meth at night so they can stay up when it's most dangerous. And then sleep during the day. There's an increasing amount of people using meth and heroin. And sometimes people use those in combination. So they'll use the heroin to offset the effects of coming down from the meth, or use the meth to offset the impacts of coming off of heroin. So there's sort of diverse uses. Since I have it, I did do a quick literature review. Do you want me to just go ahead and talk about what
sure.
I found?
Absolutely.
So I just focused on Black men who have sex with men, and the community. We don't have a lot of research on meth use among black men. So that's the first thing to say. What I found was that the range of reported use in recent times, so 30 days to 3 months, was between 4% and 28%. So it's not as popular as marijuana. I have data from one of my own studies where we looked at men who have sex with men and women. So they had to be bisexually behaving Black men. And in that group, our meth use in the last 3 months was 28%. By contrast, most people use marijuana, so marijuana use was 61%, and then crack cocaine use was about the same amount. It was 28% as well.
All right, thank you for sharing that, Dr. Bluthenthal. So Charles, I really want to hear from you because I realize that when it comes to this particular issue, crystal meth and Black gay men, as early as 2015, actually in February 2015, you actually wrote an op-ed addressing crystal meth use and saying this is something that we need to actually talk about in Black gay communities. That's 2 years ago, right? Almost 2 years, 2 years ago, 2 years ago, long before this kind of like now we're seeing a kind of public resurgence of addressing this issue. So what led you to write that op-ed and kind of bring that into the conversation at that time?
Yeah, well, I started hearing stories. I started having friends, community members, colleagues share with me some of their personal experiences. Started sharing with me stuff they were hearing. So I felt like there was a discussion kind of bubbling underneath the surface that desperately needed to be amplified, that needed to be elevated. And I also recognized, considering the number of other vulnerabilities that we face, that it was important that we begin, particularly those of us that work in public health and harm reduction, that we really start thinking about tools that we can support our community with. And I was just baffled that there was just there was this disconnect between what I was hearing and what I was seeing in the public health realm, the lack of services, the lack of information, the lack of education. And just recognizing kind of how these things happen where, particularly with, Black communities and specifically in this case with Black gay men, how late the health institutions can be to really addressing issues, and how we often wait until things are just really far along before anything happens. I thought this is definitely an opportunity, if there ever was one, to really start trying to get ahead of something before it, continues to spiral out of control. I was also interested in, again, like having community conversations, thinking about coalitions. So what does it mean if sex worker advocates and harm reduction advocates and people working HIV can begin having conversations to really address how this issue is impacting our community? And as you shared, Yolo, yes, I wrote that. I can't believe it was 2 years ago, but yeah, 2 years ago, just really raising the question. And from my perspective, so little has happened until now. In the last, I guess, few months, there's been a conversation around crystal meth in our community when something horrible and tragic happens. But, and again, I appreciate you and other colleagues for really raising this.
Yeah, absolutely. And I also want to make sure I'm intentional with naming Monique Tula, the executive director of Harm Reduction Coalition, who was was really integral in bringing us all together to make sure we have this conversation. I want to make sure that I name her work. Kenyon, most recently, you interviewed the director of Party Boy, which is a documentary about meth use in Black gay communities. Can you tell us a little bit about what that experience was like and some of the things you took?
Sure. It was so when I interviewed Michael Rice, who's the director of the documentary Party Boy. There were a couple of really interesting kind of facets to that conversation. One, when we sort of talked about the number of men that he interviewed for the documentary, and he sort of started initially because he just was kind of hearing more Black gay men living in Brooklyn, New York, who were dealing with crystal meth use. And he talked about when he decided to make the documentary and was really surprised by just posting, kind of, an ad on, Jack or Adam for Adam, and how many people were willing to talk to him. First of all, so just there were a number of people who were willing to share their story on camera. And two, that I think he told me when we were kind of in our lead up to that, when we were first having a conversation, and Michael and I have known each other for about 8 years or so, but when he told me that he talked to folks, so many of them, a vast majority of them, started using crystal meth in situations where they were kind of in sex work or kind of transactional sex relationships, primarily with white men as customers. So the white men who, they were, engaging in sex work with were using crystal meth, and oftentimes either paid them more money to use meth with them, or other kind of or made them use crystal meth as part of the even to get paid, and so many of them got addicted that way. And then after they started using crystal meth and potentially found themselves in an addictive situation, then started to sort of find each other through the kind of social media and through certain sex parties in New York. And that kind of built this sort of a specifically Black community around crystal meth use that has kind of built over the last several years. And so, I mean, that's obviously reflects, the tragedy that we recently saw in Los Angeles. But there, seems to be part of how this particular, kind of rise in crystal meth use in the Black gay community seems to be very much tied to kind of sex work and people's kind of relationship to, white gay men who coerced or in some cases demanded use as part of the transaction.
Absolutely. Thank you for that, Kenyon. You brought in the conversation about Jamel Moore, who, of course, like recently died of crystal meth overdose, and has been very much so in the news and conversation here in Los Angeles community. I think Jeffrey King and In the Meantime Men recently had a conversation where they brought a town hall where they brought people together to talk about crystal meth in our communities. Given that particular scenario and that storyline that's happening, like, what were your? I'm curious, Charles or Ricky, if you were aware of that storyline, of that situation, and what were your initial reactions and thoughts around that piece?
Yeah, people started forwarding me the link. I think when it was in the media in LA, people started sending me links to various stories around it, and we at Counter Narrative, I convened our advisory board to discuss and unpack like what an advocacy response would look like. And we've just been in conversation with various community stakeholders, but it really was absolutely heartbreaking on so many levels. It's so representative and exemplary of the ways that, state violence coupled with, individual actors, particularly agents of white supremacy, are often complicit in our deaths, if not forces in our deaths. And so it really broke my heart. I actually posted on Facebook because I was like, I don't even know how to wrap my brain around this. This is so tragic on so many levels. And it still, to my knowledge, hasn't really made its way into, I think, much of the sort of national mainstream media. Like, I don't know if it's been covered in the Times and the Post, et cetera. So I think that there's still, and I think it's representative of like the lack of public empathy that Black folks receive, specifically in the case of Black gay men, that this could happen, this very tragic death, and there not be more of a national outcry. At the same time, I am, very much inspired by and encouraged by folks that are definitely elevating this what happened in his story and in the community that's around, particularly in California. It looks like the community that sort of happened around it. I mean, just the level of power in that, and I'm inspired. But at the same time, I'm also very disappointed and angry that there hasn't been more of a national conversation. I was at an HIV conference recently, and I think there was very little conversation about this issue. And again, it just speaks to, I think, one, the need for more political will around this and how our communities are still suffering in many ways. And also, again, the need for there to be more conversation and more coalition across the harm reduction, HIV, and sex worker advocacy realms.
Absolutely.
I mean, I became aware of it because of Jeffrey King's event, and I was unable to attend it. But I have a lot of thoughts about it. So let me start with echoing what Charles said, which is this is absolutely about social structural reproduction of violence against Black men. I mean, that's what happened. And a lot of the work that I've been trying to do, not merely around harm reduction, but just around, protecting Black lives, has to do with that story where, why are we in such material jeopardy, right? So the sex hustling that comes out of not having resources. And so I think it's important that we link that together. And, for me, where I went is, as a parent in part, is you know, we've got to work on the stigma in our own community, because these are our children, right? And that, you know, this isn't, you know, obviously his mom was very supportive, and so, but and in general, we've got to take care of our children, and you know, so on an emotional level, I was very moved by it. It troubles me still greatly. The other piece of it, you know, and now with my science hat on, has to do with, you know, what does crystal meth mean to gay men and Black gay men, and the fact that it represents, from a drug use epidemiology perspective, a rare risk, in that it's always there. So typically people's drug use behaviors are sort of set in their early 20s. They don't usually escalate after that. But because of the dynamics around stigma, around, you know, being gay or same gender loving, the way that meth is used in the gay community at large, and then can be used in subpopulations, ends up creating a risk that continues throughout people's life course, whether they're white, Black, yellow, green, or whatever. And so I really feel like, and I know there are people working on this, but I really do feel like there needs to be much more concerted, concentrated focus on what does this drug mean in this community, and what are ways of mitigating its negative consequences, and particularly as it begins to move into the most vulnerable population, which is African American men. There are already significant challenges around HIV. The crystal meth stuff introduces the possibility of injection drug use, which opens up a whole Pandora's box of other health ailments that we're going to end up having to deal with, both in the short term and the long term. So I don't know that I could be more concerned. You know what I mean? I think the whole thing was awful, and I think it's a beacon to a whole set of other problems that we need to get on.
Yeah. Absolutely. Thank you. As you were talking, it made me think about when we're talking about harm reduction, right? And I know, Charles, you alluded to like the lack of capacity in many organizations that are serving Black gay men to really kind of understand cross-sectionally, and talking about sex work, talking about drug use and these different pieces. I'm really curious to hear from one of you to talk about what are some of the tools and resources, the education you feel like the communities or the organizations that serve Black gay men currently, Black and Latino gay men currently, need to understand. Like, so for example, we're talking about harm reduction, but a lot of people that I've spoken with who work in HIV and AIDS organizations that serve Black and Latino gay men, they have never really heard of harm reduction, don't understand that particular frame, right? So what are some tools and resources and things that you think we need to begin to start educating, building up the capacity of our communities to really serve and support people?
Yeah, I think one of the things that we need, so I think one of the challenges of, and why I think the sort of lack of response, and I could just say for myself, even, you know, in the last, for me, probably 5 or 6 years, it's really been kind of a slow buildup of different people that I've known, Black gay men who were using, and ultimately many of them having kind of addictions to crystal meth. And one friend who died 3-4 years ago, who I know had an addiction, and I believe crystal meth was kind of at the kind of source of his passing. But I think one of the challenges that many of our organizations, because of the way in which they're funded, so kind of your typical, you know, Black, you know, gay AIDS service organization, it's funded to do, you know, some kind of basic prevention work, whether it's, you know, kind of, you know, Debbie's and condom access, and now, you know, PrEP, and some of them have some mental health components or whatever, or group sessions. But part of the way that they're funded doesn't allow for a lot of flexibility to respond to emerging needs, right? So then you have, because it reminds me, frankly, of, you know, in the mid 2000s, when in New York, we were seeing all these Black gay men, you know, who were, you know, dead under like, you know, homicide circumstances. And the organizations in New York really didn't have any capacity to sort of respond to, you know, kind of one homicide after another, because they just, the structure of how they're funded and kind of made to perform to, you know, certain kinds of deliverables. So I think one is just like, we need more nimble organizations that are able to actually respond to the needs of the community in much faster ways. And when we're talking specifically about this issue, certainly we need more capacity building and training of kind of community-based, workers around both the sort of, what the drug sort of does in the body and those sorts of things, but really some kind of harm reduction and how to respond to stigmatizing language and ways in which people are stigmatized around use in sort of social media spaces and community spaces or whatever, and really begin to create spaces where people can really feel like they're able to connect to community and then figure out what is the best sort of strategy for them to either manage their use or to get into some substance abuse or treatment. And if they choose to, try to kind of, end usage, that those things are possible. I think those are just, for me, some of the components that are needed.
Yeah, I think that, I was just going to say that part of the moment we find ourselves in is there has been such a considerable displacement of folks that were being served by smaller grassroots organizations. So we're in this moment now where like a lot of more grassroots organizations and community-based organizations have been closed down that serve Black gay men. So now there are these sort of like mega organizations that exist in a lot of communities, and they sort of absorb all of the resources in the community. And I think we found that these very large bureaucracies very often are unable to really serve and meet the needs of communities on a more micro level. And they're not very nimble, and they're just often not as aligned and in touch with the needs of community members. So I think we really need to just rethink how resources are invested into serving our community. And does it serve us to have most of the resources absorbed by a small group of very large organizations that, say they're serving our community? And I think often when these situations happen, we see that there are a ton of barriers, a ton of things that don't happen that we would like to see happen. And I think that's also the case for community organizers and movement leaders that are often sucked into these large organizations where they're not really often able to mobilize their communities because they're too busy trying to meet deliverables. So I think we need to, that are put forth by folks that aren't really invested in saving our lives. So I think we need to just really reimagine and ask ourselves, do the existing institutions that are supposed to be serving us, are they really serving us? On a more tangible level, I want to offer 3 things that need to happen immediately. 1, I think there needs to be resources available to do community education around this issue in our community immediately. 2, I think that there needs to also be resources available to have some coalition building, some cross-movement learning. So bringing, there needs to be training, but there also just needs to be cross-movement learning. So to have the harm reduction folks and the service provider folks, and even rethinking some of those silos. I understand that that's also problematic too, but really just bringing folks together across different expertise to really have them think through ways to approach this issue. And finally, I think we need to center the stories of folks that are impacted. So, I think you shared that there's just not much in the research literature around Black gay men and crystal meth. I think that needs to change. And I think we just need to center the stories and voices of those that are impacted and really create a space for them to share their experiences.
Absolutely. Thank you. Dr. Bluthenthal, did I see you leaning in like you had something to add?
Well, I just agree 100% with what Charles said.
Okay. All right.
My favorite words.
So I really appreciate what you shared, Charles, about the cross movement, across the cross-sectional kind of learning and building, because I think there is a way in which the nonprofit industrial complex encourages us to kind of operate in silos sometimes in terms of with certain issues. So we have about 5 more minutes left. I want to get any more feedback from you all. Particularly, I'm curious about websites or tools that that exist that you want to direct folks to for further learning. I know that the Harm Reduction Coalition, of course, is a great resource. And people, you can go to harmreduction.org, to find more information. But I also want to hear from you all in terms of other things that you would like to encourage people who are listening and watching to begin to say to their communities, to engage their communities, and what you would encourage them to do.
Quickly, I would just encourage folks, especially if you work in community-based organizations or have connections, actually to Google Party Boy, that's BOI, and Michael Rice's name, and contact him to have a screening of the film and a discussion at your, in your local community.
Yeah, I mean, I think that just is to follow up a little bit on what Charles says. I mean, a lot of the power, I mean, I've been doing this stuff for a long time, and a lot of the power in response to HIV came when people were able to do that sort of cross-learning coalition building and reaching across different groups. So, like when I think about Jeffrey King's In the Meantime group, you know, like how do we get him in a room with folks who've been doing crystal meth treatment? Or how do we get him in a room with folks who are working on intimate partner violence and men who have sex with men? So, you know, that kind of communication, and, you know, obviously the Harm Reduction Coalition, talking about, you know, individual agency and how people can make better choices to be safer for themselves. So figuring out how to foster that, I think, is probably a challenge. And, you know, maybe we need to all meet and figure out a strategy just as a way of getting the ball rolling, because I do think, you know, something that Charles said in the beginning, you know, spoke to me, and it's about the moment of, you know, no one cares about Black lives as much as we do. And, you know, we have to really lead with that. And because if we are reliant on other people responding, the truth is it's just not going to happen. So, you know, I think what I'm taking from this is more, you know, what does Ricky need to be doing to make a positive contribution to that cross-learning and coalition building? And so that's what I'm going to try and focus on.
I guess 3 things come to mind for me. The first thing is, I know the NASM... The NASM Leadership Summit is happening in Atlanta in January. They're seeking abstracts. I think it'd be really interesting to maybe do a workshop or session on this issue. So if folks are interested in that, you know, definitely reach out to me, charles.stevens@counternarrative.org. Maybe we could do a session on this issue just to raise awareness. 2, I think we might need to be meeting with our policy makers and decision makers and elected officials. So if folks are interested in maybe figuring that out, I think that also might be a path forward. And finally, I think we need to continue to write about this issue, write op-eds, write personal essays, write narratives. So I think if folks are interested in doing that, I think we should definitely be in conversation.
Absolutely. Excellent. Great. So we are almost out of time. Before we close, I want to make sure I just acknowledge the organizations that once again help bring this conversation together. This is just the one of many conversations we hope to have in the future. We haven't even scratched the surface. There's a lot more to be talked about in terms of intersections, talking about syringe exchange, talking about harm reduction, talking about Hep C and HIV. There's a lot of different pieces that we need to bring into this conversation. So this is just the beginning. I want to acknowledge the County Narrative Project. Thank you so much, Charles, for your work and for joining us today. Harm Reduction Coalition for bringing us all together, for Charles Hawthorne, as well as Monique Tula. Kenyon, thank you for coming with us today, joining us. Dr. Bluthenthal, thank you for joining us as well. For all of you out there, please feel free to contact us. You can comment on this video. You can also find us on social media on our Facebook pages to continue this conversation. And we'll be in touch with building more resources and tools that hopefully will mobilize our communities and get us moved. So thank you all so much again. And I think we're going to close out this conversation. We'll be in touch.
All right, take care, everybody.
All right, thank you.